We didn't call it destination medicine at the time. We didn't call it medical tourism. We called it survival. And when I started my journey with Bumrungrad in 2006, there were only 80 Joint Commission accredited hospitals outside the United States. Today, there are over 1,000 destination healthcare. It's a no-brainer at this point.
Today, we'll be speaking with an expert in global healthcare economics and global healthcare services. He understands what it means to build high-quality hospitals that attract patients across typical geographic borders in both the United States and abroad. This past year alone, his Global Center of Excellence in Thailand served more than 700,000 international patients. Very happy to have you, David. Welcome.
Thank you. Thank you. It's an honor to be here.
How about we start? You've done so much in the global healthcare space. Can you let our audience know just a little bit about your journey in international health?
Sure. Be happy to. My journey actually started back between the mid-'80s and mid-'90s. I was managing a hospital in northern Vermont, about 40, 50 miles south of the Canadian border. And we opened up a regional chemical dependency psych program. And of course, so we attracted patients from Toronto, from Montreal, but also from Boston, from New York, from Washington, D.C. We didn't call it destination medicine at the time. We didn't call it medical tourism. We called it survival. We had bomb payments. We had empty beds. We needed to basically fill space. So it really worked out. Fast forward, Dr. Kumar, about 2006, as the story goes, and I finished reading Tom Friedman's book, The World is Flat. And the same week, I began hearing about medical tourism. And so I talked to three chums of mine who work with big companies, McKinsey, Deloitte, and KPMG. And I said, look, for the 4th of July week, 2006, I want to go to someplace I've never been before, and I want to check out medical tourism. Where should I go? Should I go to South Africa, Mexico City, Dublin, Ireland? And independently, all three people said Bumrungrad International Hospital in Bangkok, and the rest is history. But had never been to Asia, but bought a ticket, went and spent literally a week at Bumrungrad. And so that was it. I was just amazed. I gowned up and went into 3 or 4 surgical procedures. I talked to doctors who were trained from all over the world, patients from all over the world. And that was it. That was my vacation. And while that may sound boring to some, when your passion is healthcare, truly getting people well and help, it just turned into a life-changing event. So went back to South Carolina a couple of weeks later. I got into a conversation with some of the leadership at Blue Cross Blue Shield of South Carolina and regurgitated this incredible story. And I was asked to basically start a company, which we did, called Companion Global Healthcare, a wholly owned subsidiary of Blue Cross Blue Shield of South Carolina. And we contracted with international hospitals, all Joint Commission accredited. And we did on-site due diligence to do that, and entered into contracts and stuff, and started building the infrastructure on our side in the U.S. And we started contracting with self-insured employers around the United States to help them understand the value proposition, the true value proposition. I know, maybe we'll talk a little bit more about that later on. And it started work. It was very successful. So yeah, it's just that's the journey. It all started by being curious. And just, buying a plane ticket and hopping on a plane and going to Thailand for a few days. And it just turned into a life-changing experience for me.
So that's great background. So let's start actually with Bumrungrad, because you're obviously very familiar with it. Talk to me about the hospital. Many of our viewers are unlikely to know much about Bumrungrad. Maybe tell us a little bit about that hospital, and how many patients come there each year from outside Thailand to visit it? We spoke about that earlier. It's an incredible number. And why do they come there? What is the value proposition?
Sure. Briefly, the history. We're 44 years old this year. We hospital opened then, of course, in 1980. And we were a for-profit hospital. Bumrungrad in Thai means care for the people. And so that's what the mission was, still is, of course, by name. And then in 1997, the Asian financial crisis happened to Dr. Kumar. And, when that did, of course, similar to the experience that I had when I was in Vermont in 1987, we had bond payments due. They were due in U.S. dollars. The value of the Thai baht plummeted, and went from, I think, 20 to 40 in a relatively short period of time. And so the hospital leadership had to do something to basically bring in additional patients, but other currencies as well. So if you think in terms of concentric circles around Thailand, so obviously to Cambodia, Laos, Myanmar, Malaysia, Singapore, and that allowed us to build out some of the logistic infrastructure that we needed to do. And then relatively shortly after then with the Middle East, we started courting patients from Dubai, from Abu Dhabi, from Kuwait, from Doha, from Qatar, from Oman. And that's it. And the rest is history. And so people started coming in, you know, Bumrungrad was the first Joint Commission accredited hospital in all of Asia, not just in Thailand. And for our viewers who may not be aware, the Joint Commission is the nonprofit organization, Chicago-based, that accredits about 3,900 hospitals in America. And when we started the journey, when I started my journey with Bumrungrad in 2006, there were only 80 Joint Commission accredited hospitals outside the United States. Today, there are over 1,000 versus 3,900 in America. So the numbers continue to expand and everything else. So today, go back to 2023, we treated just over 1.3 million patients in a year, and just over 700,000 international patients. For the first time ever in 44 years, we went over the 700,000 threshold. And so, something we're proud of that, where we work very, very hard. So we treated people from 194 countries and territories in 2023. So it truly is the United Nations of hospital care, if you will. We have about 4,500 employees. We have right at about 1,400 physicians. We have over 350 U.S. board certified physicians on our staff. Other board certifications from Australia, from Japan, from Great Britain, of course, and other places as well. So our laboratory was one of the first hospital laboratories in all of Asia accredited by the CAP, the College of American Pathologists. And so, that's something we worked really hard. We keep raising the bar. We keep challenging ourselves and everything. And so, so that's really the Bumrungrad story. It's a logistical challenge on a regular basis. We have 15 vans that are traveling around from 7 in the morning until about 11 o'clock at night. We have 2 international airports in Thailand, so that exacerbates the challenge just a little bit. We have over 200 full-time interpreters. We have easily over 250 concierge staff at the hospital and everything else, obviously with uniforms and name badges and everything else. And of course, a majority of our employees, patient caregivers, speak English as a second language. So, I hope and happy to answer any other questions you may have.
I mean, that's amazing. As we spoke about the hospital, you experienced 700,000 patients coming from other countries to receive care. They're obviously coming there for a reason, right? Many
Sure.
of them might be able to go elsewhere, or some of them could receive care in their own countries. I consider Bumrungrad truly one of the global centers of excellence, on par with the best hospitals in the world. What is the value proposition to them of going there versus somewhere locally? And can you speak to me a little bit about that patient experience of care that a Bumrungrad or a global center of excellence would provide?
Sure. And I need to preface this conversation. I'm a lay person. I'm not a physician. I'm not a clinical caregiver and stuff, but I've worked in healthcare administration now for 46 years. This is my 46th year. So I've been around. I've been a CEO of 3 hospitals in the United States and VP of operations at a 4th. And so again, have been involved in a number of Joint Commission surveys in that capacity as well. Always a challenge, never easy, regardless of how well you think you're doing. But people, it's a great question. And there's not a uniform answer, Dr. Kumar. People travel for different reasons based on where they are. And so for instance, it used to be that many Americans, the majority of Americans who travel would travel because of price, because of cost, right? A heart valve replacement in America is about 140,000 US dollars all in. It's probably about 35,000 at Bumrungrad in Bangkok, so significantly less. People in countries like Myanmar, who from time to time have, in other countries that have civil unrest, it's always a challenge. Cambodia, Laos, they may not be perceived as having quality hospitals and quality physicians and stuff. So people with resources then will leave for different reasons. Increasingly, like Westerners, both from Europe and from the US, and from Canada, actually come to us because of wait times. It's, the average wait time to see your family doctor in the United States on average across America is 4 weeks. Many people outside of America think that if you need a hip replacement, that your orthopedic, diagnoses you and he says, this is what you need. And the next week you have your hip replaced. In many hospitals, there's about a 6-month waiting list, especially if you're on Medicare or Medicaid, to be able to get that hip replaced. That's the truth. That's a fact. And so increasingly, a lot of people say, you know what, I don't want to wait. And so they'll go to our website. We easily get about 3,500 emails a day. We get about 4,000 phone calls a day from all over the country. Our contact center is open 24/7, 365. We have inquiries for initial consultations, for second opinions. We have a team of 25 doctors and nurses, again, who work 24/7 when that's coming in and everything else. So people really travel for different reasons. Obviously, there are some people who will travel for the holiday, right? So they come, they want to maybe have some cosmetic surgery. They want to, maybe spend a couple of days in Chiang Mai or in Phuket, hang out on a beach, go and have their surgery done, and then relax at a nice hotel for a fairly reasonable price in Bangkok or wherever. So really, it depends on the person, the culture, and everything else. Other times, people are desperate. They've got a good relationship whenever their home physician is. As a physician, you probably have had this experience, and people, they have a diagnosis and they go, you know what, I'm going to look for another way. And so we offer, for like in oncology, for instance, we have a program called Esperance at Bumrungrad, where we offer our alternative medicines, things like acupuncture, different nutrition, herbs and things like that for people that want it. We don't push it on people, but it's there.
So, David, one of the points you mentioned is the importance of volume, making sure proceduralists do procedures, surgeons do surgeries in terms of quality. Do you think that's an opportunity in the international space? A lot of these large, well-established hospitals have very high procedure volumes.
Well, absolutely. I think it's a possibility. We are not alone. The international space for destination medical travelers is significant. There's a lot of competition. Hospitals in like Severance Medical Center in Korea, certainly Apollo and Fortis hospitals and others in India. Mount Elizabeth and Glen Eagles in Singapore, Sime Darby Medical Center in KL, and others. Anadolu Hospital in Istanbul, for instance. So I think again, increasingly hospitals are recognizing when their volume is up, they're doing high numbers. They can start to generate and demonstrate quality metrics and safety metrics. I think that's real important. Then it's an opportunity for them. But there's so many things that go in, Dr. Kumar, to be a really top-notch medical travel or destination medicine site, if you will. It's not just, you've got to do a great job, but from a service perspective, you've got to be able to exceed customers' expectations. And one of the previous questions you asked was about service. And so, I will tell you, in the last 2 years, I secret shopped the Cleveland Clinic for a cardiac issue. Clinically, they did a fine job, no doubt about it. One of the top, if not the top cardiac hospital in America. And I was very satisfied with the price I paid and with the service I got and the prompt and everything else. But from a service perspective, they're not in the same league. They truly are not. I mean, and part of the reason for that, at least in Cleveland, right? And part of the reason for that is labor costs. So things are less expensive in a number of countries that I just mentioned. Some they aren't, like South Korea, Albert Einstein Medical Center, Sao Paulo, costs are pretty expensive there as well. But in a lot of countries, the costs are lower, and we can afford to basically have, we can exceed customers' expectations, and we get patients from countries, unnamed countries, who've had a terrible service experience, not necessarily in hospitals, but in hotels and airports and everything else. And they're literally blown away when they come to Bumrungrad. And so just from an aesthetic perspective, um, our, our hospital was literally built as a five-star hotel with all the clinical services wrapped around off stage, the Walt Disney model, if you will. And so it's true. I mean, when you come into one of our patient floors, all of our hallways are carpeted. We know that's more expensive, but it's much quieter. It's much more professional. And yeah, we have to replace the carpet on a scheduled periodic process to do that. That costs money, in fact, to do. But overall, we just think it's a lot quieter and stuff. So
And I know, David, you spoke earlier about the shuttles picking people up from the airport. You've talked before about people might come with companions, and those companions need a positive experience. And something I don't really think about much or see happening in the U.S. I've worked at many, many great hospitals in the U.S. I trained at Mass General, at Columbia University Medical Center. I've been at Yale. Um, and I think that attention to detail and the experience and making it easy for patients seems something that's at least differentiated by the Bumrungrad experience and global centers of excellence. How do you think about that in terms of not just the patient's experience, but also their companion's experience?
great question. And it's absolutely essential for us. Cultural, and there are obviously Joint Commission standards around this, but we treat a significant number of Arabic patients and Muslim patients from different countries, whether it's Indonesia, Malaysia, Middle East, or whatever, Thailand. And so we have prayer rooms for both men and women, separate, and feet washing and everything else. We have halal kitchen that our folks have access to 24/7. That's really important. So to be, culturally sensitive as well. The average American and Canadian will travel with probably one other person. So on average, it's like two persons, total in the party. Whereas Middle Easterners, it'll be about 3.7, 3. So a lot of times, because that's just their culture, and so they come in everything. And so we make provisions for in-room. Of course, most of all of our rooms are single rooms. They all have sleep-in capability, so that's really important. But we have, we're in right downtown Bangkok, so we have relationships with a number of hotels, all different price ranges, from 400 or 500 Thai baht a night to 25,000 Thai baht, whatever you want to pay. And it's interesting. What oftentimes happens is that in certain cultures, people will come, and they'll expect that they have to observe the nursing. They have to make sure that if vitals are supposed to be Q4, if medications are supposed to be given certain doses at certain times and everything else. Many times the family or the guest will understand pretty quickly they don't need to check on our nurses. We follow up on everything, and we've got an electronic medical record, a U.S. based company in Boston. We use it. We've had it for years. So oftentimes what happens is the family members after 24 hours will say, you know what, I don't need to hang out here all day. And so what are the tourism opportunities? Can I go shopping? Can I go see the reclining Buddha? Can I go to the palace or wherever? And so we have people that are available probably 16 hours a day. They can connect people with tour guides, and we have a travel desk and everything else. We also have we have one of a representative from Thai immigration who has a space in our clinics. And so if people need to extend their visas, if they've got issues, we work very closely with the Thai government. We don't want people to have to go off-site and queue up and everything else. We try to alleviate that anxiety that the patients might have about things like that. So, we didn't learn all of this overnight. It took years of honing, and it's, we truly are in an environment, Dr. Kumar, of continual quality improvement. We know, as I mentioned this before, we know that complacency is one of the biggest problems with success. We've been very successful, but we know that there's competition out there, and we know that they're raising the bar. They're trying to get better and better. And so we know that we have to continue to try to, obviously meet the patient's clinical needs, but we need to exceed their expectations from a service perspective on a regular basis.
So you talked about continuous quality improvement just now. Quality has multiple domains: clinical quality, the quality of the experience. Thinking about clinical quality and patient outcomes, how do you think of global centers of excellence like a Bumrungrad in terms of their quality standards, and how do you benchmark them against the top hospitals in a country like the United States?
So we obviously we look at the data that's available. Obviously, in Thailand, we have to report to the government stuff. So we benchmark ourselves against that as well. We're always, because we're fairly Western. We do on a regular basis look at American statistics that are out there as well for things like nosocomial infection rates, mortality rates, morbidity rates. But it goes much deeper than that. And I will tell you, back a couple of years ago, I was doing a tour, and I had heard that we had the first inpatient robotic pharmacy in all of Asia, and I wanted to see it. We just went through our triennial Joint Commission survey about a month and a half ago. Did very well, as we expected to, but it literally is nonstop for the next 3 years. We're working. When the new standards come out, we're working on them. We're changing policies. We're looking at processes and procedures and everything else. And we're not the only ones. I'm sure, Dr. Kumar, there are other facilities that do the same thing, but we take it very, very seriously.
And you mentioned to me when we spoke a few weeks ago about cost differences. You gave me the example of an MRI machine when you were a US based hospital CEO versus Thailand. I'm thinking about that because you mentioned the price differences. Let's say give cardiac surgery as an example.
Yeah,
Talk to me about that. And you also talked to me about medications to treat, life threatening conditions like hepatitis C.
sure.
Talk to me about that difference in price that you see between what you pay in Thailand versus what you remember paying in the US.
Sure. It's no secret. And having this conversation, Dr. Kumar, for your viewers, is going to cause a little ire. I understand that, but we live in a global economy, and we have for years. And I think Tom Friedman's book, "In the World is Flat," poignantly painted that picture and things. And so, again, a G MRI made in Florence, South Carolina, or made in some other place, um, we pay 75, 80% less than a hospital in the US. It might be $3.2 million in the US brand new. We're going to pay, five or 600,000. So significantly less. Pretty much everything costs less, right? So Merck drugs, Hillrom beds that we have, our telemetry system from all, heart lung machines, all of that we pay. But it's not just in Thailand. It's India, it's Myanmar, it's China. So I think if you go through, I was thinking about this today, preparing for this conversation. I think if you would go in and look at per capita income, you can kind of see the countries that are going to pay top dollar and the ones that don't. And so it's just the way it is. We pay more for certain products. And you've heard the phrase, too much have been given, much is expected. And so the turnabout of that is, as Americans, we enjoy a nice standard of living and everything else. The expectation is that we pay a lot more. I'm of the school that I think if you look at inflationary pressures, inflation, medical CPI generally runs about double what the regular CPI runs. And so, I am really of the belief that, 2024 may in fact be the tipping point for that. It's literally, it's gotten out of hand, and the prices keep going up. You look at, I think if I read something the other day on CNBC, 26 states have a minimum wage of $10 an hour. I'm not saying whether that's good or bad, just observing that. So if your housekeeping staff and are making $10 an hour, and your nurse's aide were making 9, they go to 12, and everything gets more expensive. And then those price increases are obviously passed on the consumer, primarily not Medicare or Medicaid, primarily self-insured employers and self-pay patients. So it's the nature of the beast, if you will. And so
So if you're a global employer and you're self-insured in the commercial space that you're just talking about, what do you think? What do you think they need to think about when adopting a destination medicine or center of excellence strategy? We're already seeing in the US some large, not all, but some large employers adopting a strategy of promoting certain US based COEs. If they're thinking about now increasingly global COEs for their global workflows, for their global workforce, what would some considerations be?
that's a great question. I think that destination healthcare for global companies and for self-insured employers in America, it's a no-brainer at this point. As I mentioned, from a quality perspective, over 1,000 hospitals have Joint Commission accredited outside the United States. And it's not easy. And a lot of hospitals have to change systems. They have to change medical leadership and everything else to get there. Um, so it's interesting. I had a conversation back in probably 2008 with a very large unnamed pharma company in New Jersey, over 400,000 employees. And I was talking, I had a conversation. It was an appointment with their chief medical officer in HR. And so he wasn't in research or anything else. And I said, look, you've got 35,000 employees in Malaysia. We contract at Companion Global with Sime Darby Medical Center, and you encourage your employees in Malaysia to go there. Great hospital, why not? Right? JCI accredited. Why would you not consider having your employees in the U.S. fly there and save literally 80 to 90%, probably 50% of the procedures? Obviously, it doesn't make sense to travel abroad in most cases for a colonoscopy. Something like an appendectomy, which is emergent, doesn't lend itself to it. But there's a lot of other procedures, orthopedic, cardiology, and many others that really do lend itself. So, and I've used this, and I don't mean this statement to be condescending, but in today's world, this is not about total need, cheap, right? It's about the true value proposition, Dr. Kumar, that you just mentioned. It's about excellent quality of care, demonstrably excellent quality of care, certainly in the eyes of the Joint Commission of a Western brand, number one. And I think it's about safety, right? And so we have to report sentinel events within 24 hours to the Joint Commission. There's over 1,000 hospitals in the world now that are required to. And so that's really important, but with great service added on. And so I think the value proposition, it's just too significant to ignore. And so if the U.S. has had, pick a number, if U.S. has had 6% inflation in the last 12 months, that means medical CPI literally is 10 to 12%, compounded year after year after year. And so it's guaranteed at this point that it's going to continue to go up unless something draconian happens. I don't know what that might be, but so that's, it truly is a really good opportunity for both global employers and for self-insured employers, as well as consumers. I mean, absolutely, it's an opportunity for consumers.
Yep, I think that makes a ton of sense. Let's end with this last question.
Sure.
You spoke about medical cost inflation and globalization more generally. Are there other key trends you see shaping the future of healthcare globally, above and beyond that, or really the big thing is, CPI increasing? It's increasing more for healthcare than for other items. That trend going up and up. What do you see as key trends that are shaping healthcare?
Yeah, I think the first one that comes to mind just jumps right off is telemedicine and telehealth, remote monitoring that ties in with that as well. I've been involved with telemedicine since 1990 in rural South Carolina. And so when I was in the U.S., our urgent care chain in South Carolina was the first in the United States to implement telemedicine on demand, for non-emergent patients. Obviously, you call 911 if you're emergent. So, and we were the first. Bumrungrad was the first hospital in Thailand to begin offering telemedicine here as well. And thank goodness we did, because one of the benefits in our benefit costs, right? If we were ever to have a worldwide pandemic, that we would have a platform that we could at least observe. We wouldn't be able, our physicians would not be able to lay hands upon, but at least they could, from home, from office, from wherever. And so, in both of those instances, both at Bumrungrad and at the urgent care chain in South Carolina, they were able to, we had a system, we had a platform. And I think, here at Bumrungrad, we went from something like 600 to 800 visits a day inside of a week. The specialists, you wanted, oncology patients, UIM patients, orthopedic patients, cardiology patients, nephrology, on and on and on. And it was, we had something that was secure, that we had the documentation in our EMR already segued, already worked out and everything else. So I think that's really key. I think that the second thing that comes to mind is something that I'm very passionate about, and I think you are as well, Dr. Kumar, is longevity. Uh, and I think, Bumrungrad started a brand called Vitalife, Scientific Wellness, Integrated Health, back 20 years ago, so 2004. And that continues to improve. It continues to morph. And so, so we're constantly looking to not only on improving, lifespan, but health span as well. Um, and so looking at Dr. Peter Attia's book, Outlive, I mean, looking at the actual components. So we do DNA testing, and other people are starting to do this too. We think that's a good thing. The more consumers become aware of this, but we do DNA testing. So which allows us to allows the consumer, they may not be a patient yet, but allows the consumer to understand that diseases that they're likely or statistically highly likely to have, like diabetes, like Alzheimer's, things of that nature. And you can make lifestyle changes. Atia also talks about exercise, how important it is, restorative rest, how important that is. And so, obviously nutrition on top of that as well. So those types of things. So those are two areas that we're very bullish on. We're very aggressive in, and we're continuing to expand some of the offerings we're making in our Vitalife brand because demand continues to grow. More and more people. Not a surprise, I guess, if you look at the graying of the world, not just of America, the silver tsunami, it was once called. I'm a part of that. But you know what? I refuse to age. I want to, my wife and I want to take care of ourselves, and we want to stay active as long as we possibly can. So, those are the two main things. I think that, it's individualized medicine is obviously growing as well. That's not I'm not a subject matter expert in that space, but we're doing some things there as well. Um, and, we just need to continue. We need to continue to get better and to get faster at what we're doing. And that's the mission we're on. So anyways, I'm excited. We're adding a 212 bed hospital in Phuket, Thailand. Hope to break ground in September. We hope to be open in 2026. So it's a really exciting time. And so we'll see what happens.
Amazing, David. We're so grateful that you were able to give some time this morning, and it's nighttime your time.
It
Wanted to
is.
let you know it's Friday night for David, and we're grateful for this time. And you really one of the forefathers of this field of destination healthcare, destination medicine, and we're so grateful for your time. You've had experience in the U.S. doing this, experience globally. You run an incredible hospital internationally on par with the world's best hospitals. And, really grateful for your insights, your feedback, and thanks for your time.
You're quite welcome. It's been an honor. Thanks for the opportunity.